I've been hearing a lot of questions from Kansans about the coronavirus, so I wanted to answer some of them. Mary asked, what can state and local governments do to ensure that Kansas doctors and nurses have the equipment and facilities they need to protect themselves and care for us? There have been many reports of Kansas healthcare providers having to ration personal protective equipment like masks and gloves. This endangers our healthcare providers and everyone they treat. Governor Laura Kelly and Secretary of Health and Environment Dr. Lee Norman are working really hard to get that equipment to our healthcare workers. States across the country are having a hard time finding these supplies on their own because of the high level of demand, so we're relying on the federal government to help. Unfortunately, the federal government was unprepared for this crisis and initially underfunded personal protective equipment. Thanks to the work of our Governor Kelly and Dr. Norman, Kansas is advocating for the supplies we need, but our federal partners are not moving quickly enough. This has been the experience of many other states across the country. We need supplies urgently on the front lines. Our state and local governments are working to collect unused personal protective equipment from universities, private companies, and individuals to distribute to healthcare facilities. There's nothing more important during this public health crisis than protecting our healthcare teams so they can take care of us. Go to kdheks.gov/coronavirus to learn more about Kansas work and coronavirus.gov for federal resources.